The Human Sciences Research Council released on Wednesday its findings of a study of HIV and TB in the public education sector. This happened during the 8th South African AIDS Conference. The conference begins today and will be hosted at Durban's International Convention Centre. The study was conducted in 1,380 selected public schools throughout the country, and Professor Khangelani Zuma, the head researcher, joins us from our studios in Pretoria. Prof, it's great to have you on Morning Live. Thank you very, very much for being our guest.
You're most welcome. Thank you.
I'm glad that we got to pick up this interview. The last time we chatted, unfortunately, the Skype froze. So I'm glad we're getting this important study out to our viewers. Firstly, talk to us. Why does this study actually matter? Why is it of concern to us?
Well, we know as a society that we need a healthy education sector, and therefore it is very important for us to know the issues that are affecting educators. And therefore we conducted this study, which was a follow-up study on the one that was done in 2004 as the first ever survey to look at issues affecting education sectors around the health and well-being of educators, issues related to job stress, HIV, and therefore this is a repeat as a follow-up study on that survey, especially after a lot of interventions were put in place between 2004 and 2005 to deal with the HIV epidemic that were put by the state as well as the unions that we have in the country.
Now, this study, as we mentioned in our introduction, was conducted at 1,380 public schools. And this was throughout the country. What were you looking for in these schools? What were the criteria?
Yeah. We look at the sampling frame, which is the list of schools in the country, and we use robust scientific methods to randomly select those 1,380 schools, which were a representative sample of all the schools in South Africa, in all the provinces, by different levels of schools. In those schools, we were lucky that over 21,000 educators agreed to participate, to be interviewed, to respond to a lot of questions that were asking about their well-being, their health, their substance use, their TB and other STI prevalence, and other emotional issues that are affecting them. Among those 21,000 educators that agreed to be interviewed, a further 16,300 agreed to provide a blood specimen to test for HIV and also to test them as to how recent they got infected with HIV so that we can be able to estimate the incidence. So we're able to give numbers of how many educators were infected in the last 12 months, and we're also able to give information about how many educators that are living with HIV, out of those how many that are actually on ARVs. And we found that about 15.3% of educators were living with HIV, which is a slight increase from 12.7 of 2004.
Sure. So, I mean, the situation, from what we're reading into this, is not getting better. It's getting worse as the years go by. From conducting this study, what does this reveal about the quality of educators in South Africa?
The study explored issues that affect the educators and their well-being. It is good to the fact that educators indicated that their health status is good, which was reported by more educators than it was in 2004. And if you look back, we looked at whether there were educators that actually considered leaving the education profession. In 2004, we found that 55% of educators had ever considered leaving the profession. But this time around, only 35% had considered that. So which means more educators actually are willing to stay teaching. And a number of educators indicated that education was their first choice. Yeah. So things have improved, which is the same with HIV epidemic. The prevalence of HIV, we see it has increased. However, the increase in education, part of it is due to the fact that a number of educators are on ARVs and therefore are living longer, of which otherwise they would most likely not be around with us today had they not been on ARVs. However, among the younger educators, that is where we have a problem that we still have new infections coming in, which we estimated that in the total pool of educators, an estimate of 2,900 educators were infected with HIV in the last 12 months. And that is 8 educators getting infected every day.
Gee whiz. I mean, these figures are absolutely frightening. Now, I read the introduction. It was a little bit, it was wrong because obviously this interview was, we were trying to have it during this particular AIDS conference that was held last week. It's not happening this week. It was last week. So right. You obviously revealed the findings in the study. What was the reaction towards this? Because if I'm not mistaken, this is a follow-up study. There was one done in 2004, 2005.
That's correct.
What was the reaction? What was some of the people's reactions to it?
The issues that were raised, of course, are around the high incidence of HIV. It was also noted that there has been changes and improvements in the education sector. However, we still have a lot of work to do to curb new infections, more so among younger educators and more so among younger female educators. That is where we need to promote prevention. That is the message that we need to convey out there.
Indeed. Prof, we thank you so much for joining us here on Morning Live. Professor Khangelani Zuma, just sorry, one last question is obviously we can get the research and the findings on the Human Science Research Council's website.
Yes, the results are available, already published on the website and distributed widely.
Excellent. Thank you very, very much, Professor. Professor Khangelani Zuma is the head researcher at the Human Science Research. Let me try that again. Researcher at the Human Sciences Research Council. All right, let's take